For coming back and checking out Talks with Tim, where I'm taking your questions and giving you some answers about the gays, the gay culture, and everything of the like. When we think about sexuality, we do think about sex. So a common question I get as a gay male is, aren't you worried about contracting HIV or AIDS? Like they're these horrible, dangerous, scary gay plagues. Well, I'm here to set the record straight on the whole issue. First of all, HIV and AIDS are two very separate things. They are not interchangeable, they are not one and the same. HIV, which stands for Human Immunodeficiency Virus, is the beginning stage of the virus. It is the practical label, whereas AIDS, which stands for Autoimmune Deficiency Syndrome, refers to the later stages of the virus and when it starts to break down the body responses to diseases, and that's when folks typically get really, really sick. I cannot stress enough that the two are not interchangeable, that one does not exactly lead to the other, and that this whole thing, and today's discussion will be around risky behavior, consent, education, and resources for further education. So a big thing to know is how HIV happens, because we have to know that HIV leads to AIDS, but not as commonly as we seem to think. Typically, how it happens is it's certain bodily fluids that enter mucous membranes. So bodily fluids can include semen or blood. And when they enter a mucous membrane, that's a pretty sciencey term for anybody who's not big on biology. It's kind of think like the inside of your mouth. The inside, how it's tissuey, it's kind of wet. It's got a different sense of elasticity or stretchiness to it, if you will. Now, the mouth is just one, and it's a safe example. Think of other places where there may be penetration and things may be entering. That's the safest way I can say it. But those are places. So if you're putting things like blood, semen, fluids, drugs, and contaminated needles, and it's entering through, and that can include, especially for needles, entering the skin, going down, well, then it's just entering the bloodstream. Now, it's also a big thing to talk about how it's not transmitted, because there's almost a stigma that someone who has HIV, you don't even want to touch them. That's not true. HIV is not transmitted through the air, through the water, or through contact like touching, saliva, sweat, tears, things like that. So you don't have to avoid someone at all costs. That's not how it works. It's not as dangerous anymore. Because of ART, which is the new drug therapy that you take if the pills and medications you take if you do have HIV, what that does is it slows down the virus in the body from leading to AIDS. Okay, and because of that therapy and because of developments in pharmacology and access to medication, we find less and less folks actually going to full-blown AIDS from HIV. I'm just going to contain today's discussion to that. If you want more information, which I always recommend, education is really important. Two great websites where I personally go to for my information. You can go to www.aids.gov. That is an American source, but I do trust their research and I like the articles and what they have to write. Or you can go to www.healthycanadians.gov.ca and search for HIV and AIDS. Ultimately, I just want y'all to think, whether you're straight, gay, bi, purple, think about your sexual behaviors. Get tested often and make sure you're making smart decisions, that you're consenting with your partners. At the end of the day, it comes down to risky behavior, consent, education, and your resources. Thanks so much, and I will talk to you later. And don't forget to rate, comment, and subscribe, and share.